Injuries can be unpredictable and severe, and among them, Bailey injuries often characterized by their devastating outcomes are particularly alarming. Named after Dr. Bailey, who first described the syndrome in detail, this type of injury can sometimes necessitate amputation, a life-altering decision that underscores the severity of these cases. A Bailey injury typically involves significant trauma to the extremities, often resulting from severe crush injuries, high-impact accidents, or severe infections. The core issue lies in the extent of tissue damage and the subsequent complications that arise, potentially making amputation the only viable option. When a Bailey injury occurs, the primary concern is the extensive damage to muscle tissue, blood vessels, and nerves. These injuries usually result from an external force causing severe compression or trauma, leading to a cascade of physiological problems. The damage can impair blood flow, disrupt cellular function, and lead to secondary complications such as compartment syndrome, a condition where increased pressure within a muscle compartment impedes blood flow and threatens muscle viability. The risk of infection is another critical factor. In cases where the injury exposes underlying tissues to the external environment, bacterial infections can proliferate rapidly. These infections can cause additional tissue necrosis and complicate the healing process. In such scenarios, the threat to the patient's life and limb becomes acute, making amputation a necessary consideration. The decision to amputate is never taken lightly. It involves a thorough evaluation by a multidisciplinary medical team, including orthopedic surgeons, trauma specialists, and infection control experts. The primary goals are to assess the extent of tissue damage, evaluate the potential for recovery, and determine the best course of action to preserve the patient's overall health and quality of life. When faced with a Bailey injury, medical professionals weigh several factors. These include the viability of the affected limb, the risk of systemic infection, and the potential for functional recovery. If the injury results in irreversible damage, or if continued attempts to save the limb pose significant risks to the patient's health, amputation may become the most prudent choice. For patients who undergo amputation due to a Bailey injury, the road to recovery involves more than just physical healing. Psychological support is crucial, as individuals must cope with the emotional impact of losing a limb and the subsequent adjustments required in daily life. Rehabilitation services play a significant role in helping patients adapt to prosthetics, regain mobility, prosthetic technology, and reclaim their independence significantly, offering a range of options that can enhance functionality and comfort. However, the process of adaptation is complex and requires both physical and emotional resilience. Preventing